Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Hello, everyone. You're welcome to Early Intervention Matters podcast. We're happy to have you here listening to us today. This is a podcast platform which we host a couple of times in a month, and we've been doing this for the past 5 years. And on this podcast, we share information for parents, carers, and professionals as well on different topics related to neurodiversity. So I am Dr. Takon. I'm consultant neurodevelopmental pediatrician. I'm based in the United Kingdom. I've been practicing for over 20 years. And today I'm really happy to have Christopher join us. He's going to be sharing his experience as a parent of neurodivergent young people, and as also someone who has been diagnosed himself with ASD. So we're going to learn a lot from Christopher, but we would like Christopher to tell us a bit about himself. And thank you, Christopher, for accepting to come on the show.
Thank you very much for having me. I think the thing that parents want to know right up front is that I am the father of 2 neurodiverse daughters. The oldest is 13, about to turn 14 next month. She has both an autism diagnosis and ADHD. The youngest has an ADHD diagnosis as well as dyslexia and dysgraphia. They are 15 months apart. So they both have features of neurodiversity. In particular, the ADHD that they share is something that I also have. So I was diagnosed with ADHD and autism. The diagnosis for me was at the age of 37 before we had children. And as I said, now I have 2 preteens. I guess I have 1 teenager and 1 preteen. They're just far enough apart. The benefit of that is my diagnoses, I think, inform my parenting. They inform my parenting strategies, just as they inform how I teach students, especially the neurodiverse students that I encounter, or those with other learning differences or challenges. So I think that that's what I bring to my research as a scholar, and it's what I bring to my classroom as a college instructor.
Thank you so much for sharing that. So in terms of, you said you were diagnosed at 37?
Yeah, this is really important. I think your audience might know this, and certainly you do. The Diagnostic and Statistical Manual for the Mental Health
Mm,
Professions changed with the DSM-4 and the DSM-4
mm.
TR. So before that, I would have qualified as PDD-NOS, which is pervasive
Pervasive
developmental
development.
disorder, and so the PDD-NOS diagnoses, many of them were merged into what in Europe is still often called Asperger's. In the US, we are lumped in the autism spectrum disorder. In the US, the important thing is that we have the matrix, so we are listed as A through D, and then they give A and B levels of 1 through 3, indicating the severity of supports, the necessity for
Yeah,
supports.
yeah.
So those are important distinctions. But really, what happened was the labels that I had growing up were changed. So it went from brain trauma, um, ADD to ADHD. The
Yeah.
brain trauma was shifted to PDD and OS, which was then shifted to the autism. And I think that that's really important for people because a lot of people think that these things are static. When we are given a diagnosis that somehow it stays, I don't know how else to put it, but really um, the diagnoses evolve.
Mm,
So in the case of like my oldest, she has an A2 for social interaction and communication and a B1 for repetitive behaviors. So that A2 and that B1, they relate to the level of supports that are necessary.
mm,
So that's the important thing there is that these labels keep shifting and how
mm.
they're handled shifts. Just looking at the even the diagnoses that they receive, the oldest has ADHD combined presentation, which we put under F90.2, which is a code. She has anxiety, F41.9, all these things that get done by pediatricians, by psychiatrists and psychologists, all these labels. I'm looking at my youngest, her ADHD, her behaviors, they list as disruptive mood dysregulation disorder,
Yeah,
DMDD, which is 4.81. The dysphonic dyslexia, FA. The important thing here to a parent, all those labels and numbers, they change from the DSM-4 to the DSM-5, and
yeah.
in 2 or 3 years when there's a DSM-6,
6 is going to
who knows
change.
what I will be called?
Yeah, yeah,
And that's what I really think is important is if we let the labels alone dictate how we parent or how we teach, those labels will change. I
yeah.
was not autistic, and then the labels changed in a book. A new version of the book comes out, and now I'm autistic. And if they change it again, they may split it. I know there's talk about further differentiating once again between levels of support. Who knows? I think the important thing is that we can't let the labels alone define our children.
Absolutely. And I think this is the core is that you look at the impairment. What is driving impairment is that person having what thinking about the whole person rather like you say thinking about labels because sometimes you do these things and you feel oh they haven't met criteria but the person is still having their impairing differences and that's why it's about looking at the person looking at how do those behaviors impact on them? How do those differences impact on them as opposed to being hung on labels? You know, as a pediatrician who does assessments regularly, and because things like autism is a multidisciplinary assessment, there are times that you've done an assessment, one professional might feel I've seen this, and the other person will feel, well, they perform differently here. And then there's this question about do they meet the criteria or not? The families are telling you the difficulties they're having, and the professionals are done the assessments based on the tools and their discrepancies in agreement. So it's always important to think about the person in the child and the functioning and the impairment. So I agree with you, Christopher. So did having the diagnosis change the way you understood yourself as a parent and as a person?
I would say the labels constantly changing
Mm,
really made me more aware of the fact that the label was less important than the supports.
mm,
But the flip side of that is I'm in the United States and autism is listed under the Individuals with Disabilities Education Act. It's one of the 13 disabilities that schools are required to provide supports for. Obviously, blindness, physical motor disabilities, deafness. There's 13 very specific ones that a school must accommodate, and surprisingly, autism is one of them in the United States. As a parent, getting your child diagnosed opens the door for the
mm,
individualized education program, but the problem in the US is that it's very expensive. We do not have national health care, and so to get your child diagnosed, if the school district won't do it or there's a delay or anything like that, you're looking at anywhere from $1,500 to $3,000. If you think of that in terms of euros, which is almost 1 to 1 right now, in the UK, though, converting roughly, we'd be looking at 2,000 to, upwards of £5,000. This is a ridiculous cost that is passed on to the parent. So what this means is a family like ours, where my wife is an engineering technical writer, where I'm a college instructor, technically, I have the label of assistant professor. A professor and an engineer can get their child screened. We have insurance, we have personal income. But what does this mean for the vast majority of families in the United States or in other countries where assessment is not done for free by the schools or by the healthcare system? And what this means is that a lot of those children don't get properly identified, which means they can't get the school supports, they can't get the interventions. If we were not fortunate enough to have resources, my daughters would not have the monthly, the psychiatrist monitoring their medications for ADHD, the psychologist working with them on stress and anxiety, those things that unfortunately money buys. I mean, that's the truth. And if our family didn't have that, and if we were not in the positions we are, I don't know what we would do, which makes me very, very aware of the students I have who may deserve a diagnosis, who may have a learning difference, who may have ADHD or an autistic diagnosis that they would qualify for, but they can't get that diagnosis. So, as an instructor, I have to consider what I can do without going through all of the legal loopholes and the challenges. Legally, I only have to require a letter from the student and supports. I don't have to do anything, right,
Mm.
legally until they have an official diagnosis. So my approach is very different because I have a lot of low income students. I have a lot of first generation students, a lot who are non native speakers of English. And so for me, it's really important for me to do my best as someone who is diagnosed as ADHD and autistic and with physical differences as well. It's up to me to do those accommodations in a system that does not.
Yeah.
Quite honestly, our system fails children on a regular basis. It's what it's good at.
I know you mentioned that in I know you mentioned that in the US it's difficult. Or the UK you thought that we've got the National Health Service.
Well, you also have waiting times. I know families who have waited
Yes,
2 years.
I was going to discuss that with you. I was going to mention that a lot
Yeah.
of families are having to go private, and the assessment figures that you've mentioned is quite similar to what it costs here privately. So we're facing the same kind of problems, even though we've got a service that's supposed to do that for free, but it's there are loopholes and problems there.
And during those years that I know families that have waited, as I said, up to 2 years, for assessment,
Yeah, yeah,
that's 2 years where the child is not getting the school supports. It's 2
mm,
years where the child is not getting medical intervention if necessary.
yeah,
I don't know how to fix these systems, but they both have their flaws, and
yeah.
we're putting the children at risk.
Yeah. So tell us about your children. And obviously, you've talked about some of the support they have that's helping them. How do you manage the day to day? What ages were they when they were diagnosed?
I believe they were both in grade 2, so they both would have been diagnosed around the ages of 6 each.
Mm. Okay.
And then the newer diagnostic tests were done for the youngest in the last 2 or 3 years. Um,
Okay.
the reason for that is dysgraphia really doesn't show up until they're doing handwriting.
Mm,
So until she was at the age where they were doing handwriting, so dysgraphia is a little different than dyslexia, right? She can read. She's a voracious reader, and she can dictate beautifully, but her writing is you need to decode it. It is not in the correct order. It doesn't match the phonemes. But if you were to show her a college level text, my
mm,
youngest, we call her Ann on podcasts. Ann can sit there and read almost anything. And
mm,
amazing ability to read. A little slow at times if she doesn't know a word, but writing, she just the motor skills or the brain or I don't understand dysgraphia at all. It's outside of my area of expertise,
mm,
but when you look at her words, you would swear it's dyslexia
mm,
because it's all jumbled and all it's like, "Wow, honey, you're missing letters and the letters are in the wrong
mm,
order," and yet she can read. So,
mm.
dysgraphia was something that could not have been diagnosed until she was right.
Yeah. And so would you say that your own diagnosis of having ASD and ADHD has helped you to understand your children better?
Absolutely. I would argue in some ways that we work well as a family because of my needs. If I were to think about it, and sometimes I'm asked, I have Erb's palsy, which is
Okay.
partial paralysis of the
Yeah.
right arm, and I have some other physical challenges that can be rather extreme. And honestly, the executive function issues that go with ADHD and autism are a bigger challenge to my daily life. I can survive having a paralyzed arm, but I'm one of those people, I'll bring the wrong class notes to the wrong class I'm teaching, or my students joke that I always show up late because I set alarms and I set extra alarms and even more alarms to get to class on time in between classes. I'm very poor at time management. I'm very poor at directions. Navigating is definitely not my strength. So there are a lot of things that I'm not good at. I have to memorize idioms and sarcasm. So because I have to live that way, when my daughters get confused about the time or they have executive function issues, when they have sensory processing issues, one of my doctors described myself as photophobic. I really hate bright lights. I'm using the filters in the chat to make it look like I have sufficient light here, but I'm in a dimmed room, which is
Mm,
pretty nice of technology, but I'm trying to think of the right word. I back away from bright lights. I avoid them, so I have light
mm,
avoidance. You'll notice sometimes I close my eyes. Well, my youngest is very sensitive to lights, to sound, so she has sensory processing issues. She will suffer meltdowns in high sensory situations.
mm,
So, as a parent, because I need to avoid high sensory input, I really understand that my daughter doesn't want to go to loud places, that uh, the school cafeteria was too loud for her, or that certain events and assemblies at school were too loud and too much for her. So I think as a parent, what it does is it lets me understand what is
mm,
causing stress for my daughters, what causes them to have meltdowns, which
mm.
is really just panic. A lot of people think it's bad behavior, but really what it is a stress reaction and a desire to avoid, right? It's fight or flight, and they're being overwhelmed.
Mm,
So I think as a parent, having those experiences firsthand, I think it informs my parenting and my teaching.
mm,
So if I have a student who's saying the lights are bothering me, or I hear a buzz, or something's upsetting me, whether it's my children or my students, I think I'm very aware of those differences. And the
mm,
other thing is my youngest was nonverbal until she was 36 months. She said her first one word, and that was bubbles. So
mm.
it was 3 until she said a word, and now she's an honor student, and I was in special education, and obviously I succeeded. So again, I think as a parent, that made me far less panicky. It's like, "Okay, she's not talking yet. When she talks, she'll be ready, and if she doesn't talk, that's okay too." So I think in some ways my experiences and my challenges make me more patient with my children, and they make me a stronger advocate to their teachers and to others who may not understand them the way I understand them.
That's excellent. That's really good. So you see the world from their eyes.
Yeah, like right now, hopefully the camera doesn't fully catch it, right? But I'm rocking, so I understand when they're rocking. I understand when they're self-stimulating. Those things. This is why I love technology, right? I'm well lit and I'm fairly centered. But that's all technology trick,
Yeah.
right? It's fake. And those are things I'm teaching my daughters. Is there's ways they can use technology to help them. Like for a long time, we used text to speech, or now my youngest, she dictates since she has trouble writing, teaching her to dictate into the computer. Again, it makes it so I can go to a teacher and I can say, here I am. I'm a doctor, right? I'm Dr. Wyatt, a professor, and I succeeded. And so I know my daughters can succeed. Let me help you as a teacher. You tell me what she needs to accomplish, and I will think back of what might help her. And let's do this together, because you don't want to go in angry. And there are times when I'm frustrated with the system and I know that I can't deal with it, and so my wife will deal with some things, but I never wanna be upset with a teacher because I know that as an instructor myself, I know we're asked to do an awful lot, and
Mm.
you want a good relationship as a negotiator on behalf of your child.
Like that. You're a negotiator on behalf of your child, and working together with your daughter's teachers has been very helpful. These are really good messages and key messages for parents, because sometimes it can be frustrating for families if they feel their child is not being understood. One of the things that parents tell me in clinic is they talk about the frustrations that they have about their child not being understood, the teacher giving the child the wrong kind of strategies. So yesterday, there was a family who was quite upset about the child being kept behind when actually what that child needs was movement. And because the teachers didn't really understand that, the wrong approach was used. So I think as parents, one of the key messages here is not being angry at them, but learning to work with them because you're the one that really knows your child best.
My youngest is more kinetic. So Anne needs to always be moving. She's very energetic. She's a runner. She's one of those children you have to keep an eye on because she's impulsive and movement. As where our oldest is very ADHD, but she can sit perfectly still for hours focused on what she is doing. And she can not hear the teacher. She focuses too much on little things even sometimes. So they have different ADHDs, which has meant different interventions and different medications and different therapies until we can slowly stop using medications, I hope.
Mm,
Myself, I was on methylphenidate. Now I'm not, right, as an adult. So these are things that I certainly hope for my daughters. But because the young one is very kinetic, she was punished by being put at the wiggle table. And the wiggle table was where they put the children who couldn't sit still. Well, that is a very bad strategy for someone who needs to fidget and needs to move so she can hear. And teachers don't understand that there are some children who actually, if they're moving or fidgeting or playing with a little fidget toy, that they're actually able to pay more attention. And then there are other children, like my oldest, if you gave her a fidget, she would completely focus. Lee would be so focused on the fidget, she wouldn't hear the teacher. So their ADHDs are very different, and yet it's the same diagnosis on the big
mm,
label. It's just a little
yeah,
numeric difference in the criteria, but that's what we need to do is we need to have our teachers understand that ADHD is not always in movement, or ADHD is not always hyper focused, or
mm-hmm,
autism is not always nonverbal. In my case, it's a lot of other executive function issues and the sensory issues. So we need to educate the parents and the teachers that autism is not one thing, ADHD is not one thing,
yeah,
dysgraphia, dyscalculia. It's a lot of what we have to do as experts is teaching the
yeah,
parent, teaching the teacher,
yeah,
teaching
yeah,
the head of school, right? The head of school often is the one who makes the teacher do things that are not right for the school,
yeah.
right? We all know that school heads will often have their own way of
Way.
looking at the world, and they make the
And it
teachers do
depends
that.
on which worlds they're coming from. If they
Mhm.
believe in that, it all determines how they respond as well. Have you sometimes been judged as overreacting or too soft or too strict because people couldn't really see your neurodivergence in the room?
I don't think people understand the rigidity of the autistic brain. And now I know that again, I'm generalizing, right? Because I have very poor executive function, like many autistics, I need a very rigid structure. I like to get up. In fact, every day I'm up probably at 5:50 in the morning. I have a very set routine. At 6:15 in the morning, I am making my girls their breakfast. At 7:30, we leave the house after all of the routines are done and go to school. And I drop them off before going to my campus where I teach. So I have to have that rigidity. I need that. So when there is a school vacation or something like that, I get very anxious. So people don't understand that the schedule for my daughters, they'll say, "Wow, you really have a strict schedule for your kids. You're very rigid. You're not very flexible. Why can't your daughter just come to this event tonight that we didn't know about?" My daughters need that rigidity too. It's not that I'm being strict, it's that because they have the same issues I do, I know that if they have a change in routine, it can really upset them just as it
Mm,
does me. So that routine is so essential. And some of the rules we have that seem unfair or unreasonable to other parents, we have because my children thrive at their best with a very rigid schedule, a very rigid set of expectations.
mm,
But in other ways, we're very, very flexible in ways that other parents might not be. I have very strict rules. My daughters, I really didn't worry about what they saw on TV. We watch a lot of British and European television. I don't worry about them seeing some things, but we have a rule of no violence. We don't like gratuitous violence. Because my children with PTSD, they will both get traumatized. They have had very negative experiences that have left them traumatized from past violence they've observed. So we have a no violence rules. Well, their friends may not understand, why can't you watch this R-rated
mm.
movie? And it's because later on they will have nightmares or they won't eat or whatever. And if someone doesn't understand that thinking in pictures, the eidetic memory, where my children can remember something and describe it perfectly. So if they have a bad image in their mind and it gets
It
triggered by
sticks.
something, they can't let it go.
Yeah, it
And
sticks.
yeah, so is it being strict to say, please avoid R-rated violent movies? It might seem that way to other parents, but we know that if our daughters see certain things or experience certain things, they will be deeply traumatized. Our youngest had an incident when she was very little that involved a shooting, and she does not do well here in the United States. In Texas, they do shooting drills at school to prepare the children for the possibility of a mass shooting. Well, of course she gets upset and has a meltdown.
Mm,
I don't see how anyone who has been through any form of violence like that does not live
yeah,
with it forever.
yeah,
But in
exactly.
her mind, not only does she have the PTSD, but you add that to her neurodivergence and
Mm-hmm.
so are we strict? Yes, but we know our children's brains and we know how they work.
You've been able to function and support them because you've kept a structure which
Yeah.
works for you, but also works for them
Mhm.
and safeguards them against unnecessary anxiety. So, for other people watching, their interpretation of those behaviors is usually based on their own knowledge and expectations. And that brings me to so, in the United Kingdom recently, we've been having some politicians talking about the fact that ADHD and autism were overdiagnosed, and they felt that there's so many people getting the diagnosis and they need to do something about it. Unfortunately for them, there was people researching into whether there was a true overdiagnosis, and it came out that there wasn't an overdiagnosis. And this can be quite disabling for families because I see lots of children for assessments for autism and ADHD. In the process of me assessing children, there have been several parents who have identified what's been it's been wrong with them. Not wrong, I wouldn't use that word wrong. Parents have identified with those profiles and have for the first time been able to understand their behaviors and have gone on to get assessments. And for some families, actually, getting assessments, getting the diagnosis, say, for example, ADHD, have made them understand their child better and function better. So it's quite worrying when some people become dismissive of the fact that these conditions are real and can be impairing, and that it enables people to understand themselves better. I think that's been evident in what we've been talking about. Your ability to understanding of your own profile and your diagnosis has helped you to understand how your children experience the world and how to support them. And that's made, from what I'm hearing, it's made quite a big difference for you
And I think it
and for
makes a big
them.
yeah, it makes a big difference for them and for their friends. For my students who tell me that it's made a difference for them, I think it helps. I've had students come up to me and say, "Dr. Wyatt, I have ADHD. My parents are trying to convince me to try medication." And I always tell people when a young person comes to me and says something like that, right? These are young adults. They are adults in college. But I tell them that myself, I work towards being off medication, but I have many colleagues who are professors who have found that with ADHD that there are medications that they need because they have struggled for a lifetime. And then as an adult, when their teenager gets diagnosed, they're like, wow, hold on, this explains my whole life. And so they have found that medications as adults have allowed them to keep jobs, have allowed them to prosper, have better relationships. Now, as I said, myself, I worked on a lot of strategies to not be medicated for various reasons. One of them is I'm prone to migraines, and what I found was the medications that I tried for
Mm,
ADHD left me with migraines. And given the choice, a migraine is not something I want. But if there were other medications that didn't do that, then that would be something. As I said, my two daughters are on two different medications. My youngest is on a non-stimulant ADHD medication because the
mm,
stimulants caused problems for her.
mm.
And we are slowly lowering doses and teaching her strategies. But these are things you need to do with a doctor, a psychiatrist, a psychologist, an MD. These are not things you should do based on what you read on the internet or what you saw politicians say.
Yeah.
Politicians who are not doctors, who are not experts, are saying some horrendous things.
Yes.
They're saying horrendous things in France, Germany, the United States. We recently had the leadership of our country say that the governor of California has mental illness because he has dyslexia. I have dyslexic students. They use books on tape just as a blind person might. The blind community has really pushed for books on tape and braille and text to speech and other tools. And dyslexia is not stupidity. It isn't. You are not broken. You're just different, and there are ways to accommodate. And if anything, I know dyslexics who have done some amazing things to.
Amazing things. Yeah.
Yeah. So, but our leaders are calling things deficiencies or being broken. Right. There's a book called Nobody's Normal by Dr. Grinker, who has an autistic daughter. And Dr. Grinker is a sociologist, and he has written about this that I wear glasses. Decades ago or centuries ago, when glasses weren't readily available, I wouldn't be able to read. I'd be disabled. I could
Yeah.
not do my job without my glasses, or I'd have to have a technology that maybe wouldn't exist, like text to speech.
Yeah.
And as we get older, we all end up disabled. Right? We
Yeah.
all our hearing starts to fade, our vision starts to fade. We get older, we get, a little less perfect. So to have a president or a prime minister or a member of parliament, a member of any power tell us that we are broken and flawed, and it's just.
I think this is the this is one of the problems we've got where this negative messages go out in the public and sometimes the media take it up
Mhm,
and, overemphasize it. There were years ago where when they put on the front of the paper, parents are drugging their children to manage their behavior. There was such negative stereotypes about parents who had actually sought help for their children. And this kind of stigmatized such parents sometimes and actually prevented parents whose children had difficulties coming out to go and get help because they were afraid of being stigmatized. I am dealing with families of young adults who years ago would have had their young people assessed where those behaviors had been showing up, but because of negative messages that they've been getting from the media, from, their friends, from the community, different cultures take on these things as well. Certain cultures do not accept
mhm.
that concept of differences. And that kind of stalls those young people getting the help they need. And it's impacted on them long term because these are young people whose trajectories would have been completely different if they'd had that help and early intervention. And so it's just to emphasize that these negative messages are quite harmful for parents, harmful for young people, harmful for families who are going through things and really do need help. That's not something that we need to be promoting. We need advocates in government, we need advocates in the public emphasizing why this is wrong.
I am deeply concerned with the guilt that some cultures put on the parent. The child who gets a diagnosis of a neurological difference, a physical difference. When I was growing up, there were individuals who would say that my palsy was the result of something my parents or grandparents must have done. This idea in some religious cultures, some countries even now, right? Entire countries, that how you are born represents sin or darkness,
Mm,
or autism is the result of your parents deciding to do something. Like, it can be as simple as getting you vaccinated, but it can even be more complex, that your parents had a bad life and so you are damaged. And we see this in cultures, as you said, when a parent has that guilt. When you tell a parent your child is needing supports because of something you did, well, how can that parent feel good? How can that parent
mm,
feel like a collaborator when you've told that
yeah.
parent, you messed up, so your child is autistic or ADHD or has dyslexia, dysgraphia, or a physical
Mm,
difference. These are incredibly hurtful, harmful, and yet there are people in the world who will use that to gain power and influence, and that's just a
mm.
shame.
Absolutely. And that's why, yeah, and I think it's one of the things that made me start this podcast series, because I was saying that negative message that parents had been giving, affecting their ability to acknowledge or accept that their child was different and not broken, and that that child can achieve anything they want with the right level of support. But families just didn't want any label, anything at all, which again is one of the things that I keep trying to reiterate on this podcast series, because I think we need to change that narrative in different cultures as well.
It can be very culturally specific. So I've had students who are from the Hmong culture and also from the Somali culture. And those parents come from a culture where um, I don't know if shame is the right word, but the family doesn't want the child to have a difference.
Yeah,
So there's a cultural weight as new immigrants into as part of a diaspora here in the United States. They don't want their child to be autistic or
yeah,
to have dyslexia. But these are difficult transitions for those families, and now on top of it, you've told them that their child has something wrong, because wrong is how it sounds.
mm,
We know that for many years that the new immigrant populations in America, especially from particular regions, were avoiding medical care, whether it be vaccinations or even simple physicals. They were avoiding medical care because they were afraid of, we call it Western medicine, but they had practiced traditional medicines where they were from, alongside modern medicine, if you want to call it that. And I think both were valuable. And what we had to do is show them how they could integrate their cultural traditions and the medical practices of our culture too. There is nothing wrong with having your acupuncturist and your other things from your culture, but you still also need your MD to help you with your child. But teaching them how to integrate two cultures, it's scary for them, and we need to appreciate that it's scary.
and I think that's where advocacy comes in, because sometimes you need to spend time with them to actually understand what their fears are. And I think one of the things is sometimes it's not just educating one person, it's educating the family setting, the community setting, because you can talk to them and they go back in and they still get back those things. So yes, and I know there will be families listening to this today. Hopefully this conversation has helped them as well. Some neurodivergent parents talk about burnout, chronic burnout. Do you experience that? And how do you support it? And what do you do to, protect yourself, to protect your energy? How do you address that?
I have a wonderful partner in life. My wife is amazing. And I really think that that's very true. We trade off responsibilities, right? I take my daughters to school and pick them up many days. She takes them on Mondays and Wednesdays. I do the other days. And that's because of my teaching schedule. So we share cooking, cleaning, all of that. That way, not expecting one of us to do everything. I think that's really important. You can't do everything. That allows me to have an hour or 2 for myself in the evening. That allows her to have an hour or 2 for herself in the evening. It is really important to have that time. For me, it's reading, writing, something enjoy. For her, she does needlework, she does cross stitch and crochet and things like that. She also reads a lot. I think that having that time for yourself is very important. I also think it's important when you're about to have that meltdown, that sensory overload, it's okay to say, I need to get out of here. I need to walk away and go to a quiet space, a dark room. As someone who was having migraines a few years ago, I came to realize, okay, I'm starting to get a headache. I need to go and be alone so I don't get angry, so I don't get difficult to be around. I think it's very important to know when you need to say, it's time for me to walk away and cool down and have some time for myself. And so we have set our schedules to do that. Like today, my wife is with the daughters while I'm doing this podcast. And I think that that's so great that I have someone I can do that with. I know not everyone does, especially in the autism community. We don't always have those close friendships and close connections. So I'm very fortunate to have a partner in life who is that way. But the important thing is that I know myself and I know when to say no. When the school asks me to go to an event and I know I can't be in a big gathering, it's just going to be too noisy. It's going to be triggering. I can't do it. Saying no is sometimes the best thing we can do for ourselves.
That is such a powerful message that you have delivered. Families, parents should know themselves, be able to recognize those early signs that they're about to have a meltdown because and recognize those early features. I think sometimes parents take on so much and they're almost reaching that boiling point where they haven't been able to have spaces to let out. And also what you've said again is having a supportive partner. And if it's a single parent raising, just recognizing or having support from family members, people who can step in to offer that support, maybe look after the child, to give the parents some space to just be able to decompress and do other things. Just taking time out
Mhm.
is absolutely useful. And just to recap for families listening, we've been talking about how talking about how parents can support their neurodivergent child, and for parents who are neurodivergent themselves, how knowing how your child functions, how you can advocate for them at school, in other settings, even with friends and other family members. You can be that advocate because you actually understand your child and not feeling bad when you have to put in some barriers to protect your child, not feeling guilty when you have to do certain things that would benefit your child. So that's really important. And we've also talked about recognizing yourself when you need that break, when you need to actually take some time out and step away from all the noise and the chaos and just needing support from family members at home. You've spoken about so many practical examples which I feel families will benefit from. So I just wanted to ask for one final advice that you have for families who are supporting neurodivergent children.
I always say the key to what we've been able to do is to listen and pay attention to our children, especially as they get older and more capable of expressing themselves. But even when they were young, a lot of it was paying attention to what they're expressing. When a child is having a meltdown, they're trying to tell you something. Now that they're preteens and teens, they can tell me things more directly, like, Dad, the light's bothering me. Dad, this sound is bothering me. Or Dad, I smell something way too strong and it's really upsetting me. So there's sensory information they can now convey to me. Also, how they're doing at school, they can talk to me about that. So a big part of it is being able to listen. Listening means not interrupting, not telling them that they're wrong about something. Sometimes it's not even giving advice. And in fact, often it's just letting them talk so you can hear what they're saying. And that's true of my students too. Sometimes they may say something, and the best thing I can do is say, I'm glad you told me. And don't try to correct them. Don't try to give them advice. Don't try to solve their problems, but listen and try to understand. And even if they can't speak or they're nonverbal or less verbal, listen by watching, observe, take it in, try to figure out what they're conveying. Listening is how you parent, listening is how you teach. And I hope I'm a decent teacher and a decent parent.
You've definitely conveyed that, and it's just lovely to see the strategies you have used, and I could just see how you and your partner working together has provided the calm environment, and your children then feel that they can trust you. They feel safe. And I think when children feel safe and they feel they can trust an adult, they feel more secure and able to express themselves better. So that's something that I hope parents have taken on board. I think that's a very key message. Listen, listen, listen. Sometimes parents get very frazzled when the child is having a meltdown. Sometimes parents become panicky, they don't know what to do. And the reactions from parents can escalate that as well. So that's a very important message about listening and watching and observing and knowing when to step in. So thank you so much for that information and those practical examples that you've shared. Was there any question you had for us before we round up?
I really believe in what you're doing, what others are doing. Most of what I write and publish is never going to be read by the public. I'm writing academic articles, and I just did an academic chapter in a book that the parents aren't going to read those things. So giving myself this opportunity, giving others this opportunity to be heard, I think is really valuable. And I don't want anyone to think that I'm trying to tell them how to parent. What I'm trying to say is, this is what's working for me. I happen to be autistic. I happen to be a researcher. I think those things all contribute to what I'm saying. But yeah, I just appreciate what you're doing, and the fact that you've done it for several years, I think is amazing. So thank you for what you're doing.
Oh, thank you too. I think it's having you and others who come on this to share that message, because I'm sure there will be parents that will listen to this and would feel empowered. They would feel encouraged. They would see that you can move from not speaking to speaking, from not achieving to achieving, and it will give lots of families hope, which is what we want that message to go out. Because as we've talked about, there's a lot of negativity out there, and that's kind of pushed a lot of families away from getting the help that they should be getting. So thank you so much for coming on to share your experience, which will make such a big difference to our audience.
Thank you so much for the opportunity.
Thank you. Thank you. As we always say, early intervention leads to better outcome, and early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.